For 2010, National Patient Safety Goal number 7 has been expanded to also focus on prevention of central line-associated bloodstream infections, multi-drug resistant organisms, and surgical site infections. It's been estimated by the Centers for Disease Control and Prevention that annually 1.7 million healthcare-associated infections occur, nearly 100,000 patient deaths occur as a result of these infections, and $28 to $33 billion are spent in the U.S. to treat these infections. The 4 most frequent healthcare-associated infections are urinary tract infections, surgical site infections, pneumonia, and bloodstream infections. Some of the risk factors for healthcare-associated infections are a prolonged hospital stay, the severity of underlying illness, compromised nutritional or immune status, use of indwelling catheters, failure of healthcare workers to wash their hands between patients or before procedures. This brief overview of the 4 healthcare-associated infection prevention bundles that our hospital has implemented is a reminder of the precautions we take and is meant to supplement your more in-depth training. Your support and consistent practice of these measures is the key to our success. Clean hands, washing with soap and water, or using an alcohol sanitizer are one of the best defenses against healthcare-associated infections. The lower the compliance rate, the greater the opportunity for cross-transmission of antibiotic-resistant organisms to our patients. So remember the 5 basic moments for hand hygiene: before patient contact, before an aseptic procedure, after blood or body fluid exposure, after patient contact or removing exam gloves, after contact with surroundings near the bedside. Be sure to instruct patients to wash or sanitize their hands before meals and after using the restroom. Also, include the family and visitors in hand hygiene instruction. Document hand hygiene education in the chart. Don't let this be you. Remember, careless hand hygiene practice can easily transmit infections to your patients, our coworkers, and you. Central lines or central venous catheters may provide many benefits to patients. However, they present a risk: the development of central line-associated bloodstream infections. The majority of these infections are considered preventable by the application of the evidence-based central line bundle. Thus, Medicare no longer reimburses hospitals for the cost of treating such infections. The elements of the central line bundle are: provide education. Catheter-associated bloodstream infections educational materials are available in forms fast. Give the patient a copy and place a copy signed by the patient in their chart. Perform hand hygiene prior to insertion or manipulation of the catheter. Perform hand hygiene prior to insertion or manipulation of the catheter. Use a catheter insertion checklist. This will require the patient's nurse to act as the observer or auditor to record the physician or PICC line nurse's adherence to the bundle. Avoid using the femoral vein for central venous act. Use maximal sterile barrier precautions during insertion of the catheter. Use a chlorhexidine-based antiseptic for skin preparation in patients older than 2 months of age. The antiseptic must be dry before skin puncture. After insertion, disinfect catheter hubs, needleless connectors, and injection ports before accessing the catheter by cleaning the hub with 8 to 10 twists with an alcohol swab. Allow it to dry before accessing. Assess the need for the central line daily and document it in the patient's medical record. Patients who are colonized or infected with multi-drug resistant organisms, or MDROs, as well as C. difficile, can be sources for cross-transmission to other patients. The following prevention strategies or evidence-based bundles have been implemented in our hospital. MRSA nares cultures of high-risk and ICU patients on admission to identify MRSA carriers. Excellent hand hygiene. Daily cleaning in patient rooms. Cleaning disinfection of medical equipment between patient use. Use of contact precautions when caring for MDRO and C. difficile patients. All persons entering the patient's isolation room must wear a gown and gloves. These items must be removed before exiting the isolation room. Hands must be washed or sanitized with an alcohol hand rinse. If the patient has C. difficile, individuals must wash their hands with soap and water and not use the alcohol-based sanitizer. Education for patients and families on prevention strategies and steps they can take to prevent such infections. Materials are available in forms fast. Give the patient a copy of the handout and place the copy signed by the patient in the patient's chart. Surgical site infections are the second most common healthcare-associated infection. Before surgery, provide patients and family members with information regarding surgical site infections. These materials are available in forms fast. Patients admitted the day of surgery via prep or ambulatory will receive educational materials from the nursing staff there. When a patient is having an unplanned surgery, such as those admitted through the ER, nursing staff from the inpatient unit must provide and document patient education. A copy of the materials should be given to the patient and a copy signed by the patient placed in their chart. Other elements of the surgical site infection bundle are appropriate use of prophylactic antibiotics. Prophylactic antibiotics should be received within 1 hour prior to the incision. Selection should be consistent with national guidelines and should be discontinued within 24 hours after surgery in time. Maintain immediate postoperative normothermia in colorectal surgery. Appropriate hair removal, clipped, not shaved,